Kwekwe, Tansei, Ulukut, good morning et bonjour. I'm here today with Minister Bennett and, as always, Chief Medical Officer Tom Wong of Indigenous Services Canada and Associate Deputy Minister Valerie Gideon, Indigenous Services Canada. I want to acknowledge first that I'm on the traditional territory of the Algonquin Anishinaabe people. Je vais commencer en vous donnant un aperçu des chiffres pour les vaccinations. En date du 22 juin, nous sommes au courant de 687 communautés autochtones avec des vaccinations en cours. Un total donc de 601 430 doses ont été administrées, correspondant à 77% des personnes âgées de 12 ans et plus dans les communautés des Premières Nations, des Inuits et des territoires qui ont reçu une dose de vaccin. Très important, 49% ont reçu une deuxième dose. So that's over 77% of the 12-plus population and close for the first dose, and close to 50% with a critical second dose of the more than 600,000 doses that have been administered. En ce qui concerne le nombre de cas au 22 juin dans les communautés des Premières Nations, sur les réserves, nous sommes au courant de 673 cas actifs, ce qui heureusement est une diminution importante par rapport à la semaine dernière. Cela nous amène donc à un total de 31 639 cas positifs confirmés de COVID-19, dont 30 610 sont guéris et tragiquement 356 décès. I also want to give you a more detailed update on the situation in Kashechewan First Nation in Ontario. As of yesterday, we are aware of 87 active cases and thankfully 215 recovered cases. Since June 15th, the active cases have gone down by over 65%, so on a week-over-week basis. We've been monitoring all actions taken very closely while working diligently with all our partners in the communities. Again, we're working with Muskegowit Tribal Council, Winnebago Area Health Authority, the Anishinaabe Police Service, the Canadian Armed Forces, the Canadian Red Cross, and other federal and provincial government departments. I do want to commend the community's leadership, particularly Chief Leo Friday, for their great collaborative work. As a result of listening to the voices of the community, there has been significant progress. Temporary structures are in place for isolation, as well as 6 medical isolation domes used to isolate, quarantine, and treat patients. As of June 30th, 3 of those structures were up and running and providing patient care. There's also extra mental health support available to any community member who needs someone to talk to. To give you a more detailed overview of the amount of personnel that's in the community helping out, there are 17 nurses, 4 paramedics, 10 mental health providers, 16 team members from the Canadian Red Cross, 14 Canadian Rangers, and 13 Canadian Armed Forces soldiers. One of Indigenous Services Canada's senior representatives with health professional expertise is helping with the coordination effort on site. And we won't hesitate, obviously, to provide more resources as they are needed. We have, as part of this, seen great displays of leadership by Indigenous peoples across the country working hard to decrease the impacts of the pandemic by organizing vaccination clinics and educational programs that stress the importance of vaccines in a culturally relevant way. And a good example of that is in Manitoba at an Indigenous-led vaccine clinic in Portage la Prairie, offering a safe, inviting space and taking a holistic approach to vaccination, starting with a smudging ceremony. So far, they've vaccinated well over 2,400 people. In Ontario, Niagara Region Public Health Authority worked in partnership with Indigenous organizations such as the Fort Erie Native Friendship Centre, Métis Nation of Ontario, and others to run clinics targeting the Indigenous population in the area. Since March, they've held 11 clinics for adults as well as youth and have been successful in administering well over 3,800 doses and 4,000 second doses. This is a great achievement. There's also great news from Nunavut, where just yesterday the Premier announced 0 active cases. They've been dealing with an outbreak since mid-April, and there have been 262 recoveries. I'd like to acknowledge all who have put the hard work to get that outbreak under control. Obviously, Premier Savikatak, NTI leads President Aluki Kotirk, James Utuluk, and critically President Natan Obed of ITK. We know this isn't over, but it is obviously very encouraging news. En terminant, j'aimerais encore rappeler à tous, s'il vous plaît, continuez à suivre les directives en matière de santé, portez votre masque en public, évitez les grands rassemblements et lavez-vous les mains régulièrement. En général, évidemment, les conditions s'améliorent, mais nous ne pouvons pas baisser notre garde, nous devons demeurer vigilants et continuer de suivre l'exemple des responsables de la santé publique qui assoupliront progressivement certaines directives sanitaires lorsque ce sera approprié. Il reste toujours des défis à relever. Cependant, la baisse du nombre de cas et l'augmentation des vaccinations est très encourageante. Si vous n'avez pas encore reçu votre vaccin, je vous encourage fortement à le faire afin de faire partie de l'effort pour protéger votre famille et votre communauté. Et évidemment, n'oubliez pas de recevoir et d'aller chercher votre deuxième dose. Pour ma part, j'en ai une de planifiée le 3 juillet. Miigwech, Nakumik, Marcy Cho, thank you et merci.
Kwekwe Tansei. Bonjour. I want to acknowledge that I'm on the unceded territory of the Algonquin Anishinaabe people. Nous devons rester vigilants avec les mesures de santé publique, incluant la distanciation physique, le port du masque, se laver les mains, éviter les grands rassemblements et recevoir le vaccin si on y est éligible, afin de nous protéger ainsi que nos communautés contre les variants qui sont plus contagieux. We need to be vigilant with public health measures, including physical distancing, mask wearing, hand washing, avoiding large crowds, and getting the COVID vaccines if we are eligible to protect ourselves and our community against the more transmissible variants of concern. I would like to highlight some of the wonderful vaccine initiatives happening across the country, offering a culturally safe space to Indigenous peoples. This past weekend, for example, Indigenous health groups hosted a vaccine clinic at the University of Toronto, Varsity Stadium for Indigenous peoples aged 12 and up, during an outdoor powwow with singing, drumming, and dancing, supported by public health measures. Also, the Manitoba Inuit Association has had an ongoing clinic in Winnipeg, where over 400 Inuit living in Manitoba have been vaccinated since the start of their clinic in April. A walk-in vaccine clinic was opened up in Iqaluit last week, offering Moderna and Pfizer vaccines to adults and teenagers ages 12 and up. As summer months are upon us, meaning more desire for outdoor activities, we need to ease public health measures gradually, guided by the local context, to avoid the resurgence of yet another wave of COVID-19. Miigwech, Nakumik, Marcy.
Merci. Nous allons maintenant prendre les questions des journalistes, une question et une question de suivi. We'll now take questions from journalists, one question and one follow-up. Operator, first question, please.
Thank you, merci. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Christy Kirkup of the Globe and Mail. Your line is open. Please go ahead.
Hello, Minister. I'd like to ask you today about Canada Day. This is something that is being discussed by the Conservative leader, Aaron O'Toole, today, saying there's no reason to cancel Canada Day celebrations and that he can't stay silent when people want to cancel Canada Day. Given the revelation at the former Kamloops Residential School at the end of May, I'm wondering how do you think Canada Day should be marked this year?
That's for me or Minister Bennett, Christy? Or both? I didn't hear her. Maybe she's cut off, but I'll... I'm from Quebec, where Canada Day is at times controversial as well. It's something I've always celebrated. I continue to learn. I understand, as with Canada 150 celebrations, how deeply wounding, particularly in this time where I know 3 weeks have passed 4 weeks have passed since the news at the Kamloops Residential School site have occurred, but for a number of the people that are deeply involved in this, it doesn't feel like a day has passed. And so it is with some reflection that I am looking at Canada Day and looking at what that represents for Indigenous peoples. I plan to spend some time with Indigenous peoples on Canada Day. There are many Canadians that want to celebrate what I believe to be one of the best countries in the world. But for many, that isn't the shared reality. And I think that's the diversity of our country. It is, I think, on reflection, it is in part what makes our country able to look at itself and say, we're not perfect. Indeed, there have been atrocities committed on this land, and to reflect upon that. And so it's a period of reflection. And you know, it isn't a rah-rah time. I think, particularly in my position, and the minister that Bennett and the position Minister Bennett occupies, but we can spend that time reflecting on what we are as a country. As you know, the flags are still lowered to continue to commemorate the children that were stolen from their communities and taken to residential schools. Those wounds are still very much open in Indigenous communities. It's something that Minister Bennett and I are dealing with every day. So I certainly have mixed views on it, Christy. I don't know if Carolyn wants to complete that.
Yes, I just following up on what Minister Miller said. I think it is a time for reflection from the revelation into Kamloops to National Indigenous Peoples Day to Canada Day to when we get to September 30th, the first National Day of Truth and Reconciliation. I think that this will be a full summer of reflection where we Canadians have been confronted with the history, but how those damaging colonial policies are still affecting First Nations, Inuit, and people and Inuit and Métis people today. It is about understanding that harm was done, that we're sorry, and that we're putting in place the things to make sure it never happens again in terms of the true restorative justice that First Nations, Inuit, and Métis are looking for. So on Canada Day, I will be wearing an orange shirt. And I do think that lots of people feel that that would be the appropriate thing to do, as well as celebrating the best country in the world, but that made some very terrible mistakes.
Christy, do you have a follow-up?
I do. Thank you. And sorry, Minister Miller, I think you asked me to clarify who I was asking the question to, but I apologize. The line isn't great on my end, so I apologize for that. I'm wondering actually to ask a question perhaps to Dr. Wong just about COVID-19 as it's presenting itself among children in Indigenous communities. I'm wondering, Dr. Wong, if you could please tell us how, what we're seeing among young patients. How is COVID-19 manifesting itself among kids, particularly those who have yet to be vaccinated? Thank you.
Well, thank you very much, for the question. In general, in young people, this infection is milder, than, say, for example, in elders. They are less likely to be hospitalized, and they're less likely to be fatal cases. However, having said that, we have seen situations whereby children and teens get admitted to hospitals, and there have been fatal cases as well. So this only reminds us that even though the risk of severe cases, are less so in children and in teens, it is very important to actually get the vaccines when they are offered and when the children or, the teens are eligible to get the vaccines. Right now in Canada, the vaccine, Pfizer vaccine, is authorized to be given to children up to the age of 12, from 12 and up. In the future, there are possibilities, where there could be vaccines that could be offered and authorized, to even younger children. The reason why this is so important, is that children, can actually harbor the virus and can actually spread, to their parents, their grandparents, their uncles, and their aunties. It is so important, that everybody needs to be protected. When there's a vaccine available that's effective and safe to use in the particular age group. Thank you.
Thanks, Christy. Operator, next question, please.
Thank you, merci. La prochaine question, the next question is from Glenn McGregor of CTV News. Please go ahead. Your line is open.
Thank you. Yeah, we're having a lot of trouble hearing Minister Miller. Just his audio connection seems to be poor. I want to ask about the recent burning of 2 Catholic churches on Indigenous lands in the Okanagan. We don't know what the cause of this was exactly, but the RCMP are treating them as suspicious. And given the proximity to Kamloops, there's lots of speculation about that. I'm wondering, Ministers Bennett and Miller, what your reaction to that was, and if it raised any concerns for you.
Well, yeah, and I don't have any more information than you do, Glenn, and I hope you can hear me now. We've seen, as a result of the events in Kamloops and the immense pain felt in communities, a reaction towards some churches, certainly in other parts of the country as well. I do understand that volatile substances were found at the 2 sites in BC, but I have no other information other than that. Again, it's people suspect that it was a targeted attack, but we don't have those facts yet. But certainly there is great anger against the Catholic Church and other churches as well as a result of this. And so that's all I have to add at this point. I think we have to let that investigation continue. I think caught in the middle of this are people that are Christian and Indigenous communities that are going through a number of profound reflections, and that is something that I can't speak to, but I know it does add a level of another layer of complexity to what is a very painful situation for all. Carolyn?
Is the department in any way tracking these and possibility that this kind of thing could happen, given how strong people's feelings have been since the revelations about Kamloops? And if so, I mean, do you have a message for people who are feeling that anger, who see the Catholic Church as a major actor in the residential schools and want to express their anger in this way?
Yeah, I mean, Glenn, I'll let Carolyn complete this. Logistically, at the Canadian government, the civil service has an operations point where we are getting all the information together as to what communities want to do what with their residential sites, and the approach that we will let them take. They will take themselves, and we will get out of the way and support financially. I think we're in a very difficult situation where, if you look at the history of residential schools, you can't have the federal government in the lead in all this, but we can be there. It's not an equivocation. It's just you can't have the perpetrator investigating the crime. And so it is with that framework that we approach this, and the respect that we have to have for communities taking the lead on all these matters. And within communities, there are various reactions. One is pointed anger towards the church, particularly in the refusal to hand over documents and refusal to acknowledge responsibility, and ultimately to ask for forgiveness in a comprehensive way. As with all expressions of pain, the consequences are quite natural, but often very unpredictable. In this case, you see it happening all over the country and directed in part at churches, and I can imagine directed in part at leadership to some extent, in a search for answers and in a profound expression of pain. We're dealing with deep psychological processes, and it is very difficult to sit here in Ottawa and think that I have all the answers to these. But we've said to any community that's willing to move forward that we will be there to support them. It's something that we will continue to do, and we know that it will cost money, but we will be there for them. I think Carolyn has some views on this as well.
Yes, I think, Glenn, that what we're hearing from communities is that, as Marc said, that there are many members of the community that are very religious, and that they're worrying that for them to be able to go to church in safety and security is very important to them, and so it as when people act in pain, that there needs to be an understanding that this also can cause pain to people who still are very, very faithful to their religion and to their church. So even though this is about a building, I think that what leadership has been saying to us is that this has a very profound effect on the congregants and in these Indigenous communities. So I think when you think of hatred or pain, in my riding, the synagogues all have to have security. Like, this is again about how do we move forward in a way that doesn't hurt other people, and I think that the elders and the knowledge keepers are wanting to do the kinds of concrete gatherings, ceremonial fires, sacred fires that will help with the healing and help people deal with their pain and their anger in a way that helps the whole community go forward, and we will be there to support them in whatever gathering, whatever coming together that is required. We will be there to support communities as they do this difficult work and as they move forward in their grieving and in their healing.
Thanks, Claude. We'll now turn to questions in the room. Nous allons maintenant prendre les questions dans la salle.
Hi, Olivia Stefanovich, CBC News. My questions are for Minister Bennett, Minister Miller. I'd like to put to you something that Chief Leo Friday of Kashechewan has told me, which is that he believes the COVID-19 outbreak in his community would not be as severe as it is right now if it were not for, if your government had provided more houses. So I'm wondering, what is the federal plan to provide more houses to Kashechewan First Nation? And he's also concerned about the relocation plan to move this community to higher ground. Can you provide an update on that?
Yeah, I think he's right. I mean, he's absolutely right. We did, I mean, from in 2015 and 2017, knowing that this is a community, as you said, Olivia, that gets evacuated once a year because of the flooding in the James Bay area and the thaw. We did it. We've done it twice now throughout COVID in a way that's, has encouraged going on the land because the evacuation into communities is problematic because of being a vector of COVID. It was a real concern that the community and an outbreak like this would happen earlier on. There's been a firewall, obviously, with a high dose of vaccination, which is good for those that are the most vulnerable, as Tom was mentioning earlier. But it's hit the youth populations very high. And that's scary because Kashechewan, along with other communities, does have a very high youth population, and they are living in very crowded conditions. We've been saying this from the get-go, that communities, the vulnerability, which we use as a rule and a number that we use, about 3 to 3.5 times to 5 times more vulnerable to getting COVID and to suffering the ill effects of COVID, is due to crowded living conditions, among others. But it is a principal driving factor. There have been investments. There obviously have not been enough. It is complicated by the potential long-term move to Site 5 on higher ground. I spoke to Chief Friday. We exchanged texts last night, and as well as this morning, about accelerating the Site 5 move. Obviously, in the middle of a pandemic, that has slowed down, no question about it. But it is a long-term plan that we remain committed to it. It is a very complicated one because you're talking about community consent. People have lots of views on as to whether they move or don't move. But the long-term move to Site 5, if the community continues to so wish, we are 100% behind. As to the reason I'm mentioning that is because when we talk about housing, we have to talk about temporary fixes or medium-term fixes. Some of the housing that was put in 2015 or 2017 is raised, and so that's a factor that we have to play into as the community decides to move potentially over the medium term. So I'm supposed to speak to Chief Friday around 3 today, but we have spoken about that, and I think that is, well, his principal preoccupation is to make sure no one dies. But in the medium to long term, it's to reignite those discussions in and around housing. We have large budgetary sums that were dedicated in budget 2021, and obviously we want to get that budget passed. It still is not passed, and then move quickly on being able to deploy funds, whether it's rapid housing or other accommodations going into the fall, because COVID's a risk. Tuberculosis is a problem. Anything that is respiratory in nature that spreads quickly in that type of housing is a problem, and it isn't limited to Kashechewan. So I hope that answers your question.
Thank you. And as a follow-up, the U.S. Secretary of the Interior announced that the U.S. will be investigating burial sites at Indian boarding schools. And I noticed that you ministers had a meeting recently with this secretary, virtually at least. And I'm wondering if Canada has any involvement in this, whether it's collaborating, providing advice, expertise, or doing any work with the U.S. on this.
Well, I mean, as with, it's our shared history, and it's a shared stain on our respective histories. In certain respects, we are ahead of the U.S. in our the truth part. You could take any position on how we are ahead on reconciliation. It's not about comparing notes. It's about getting stuff done. Secretary Holland was moved to tears when we met her about the events in Kamloops, and I believe she'd written an op-ed the day before. This is something she believes quite profoundly, and so she is in charge of a very, very large department, and I believe that she will move quite aggressively on it because it is not only her reflective of the past that her peoples have suffered, but others as well. And I think Carolyn has more to say on this.
No, we had with Secretary Holland a wide-ranging discussion, including, of course, the work that we're doing collaboratively with the United States and Mexico on violence against Indigenous women and girls. On this, I think that we would certainly, I know the National Center on Truth and Reconciliation will be able to show the kind of archival data that they are putting together to be able to deal with the burial, death, as well as cemetery registries that they've been working on since 2016, and I think that some of the learnings there, I think, would be helpful, and obviously we would make that resource available should the secretary want to avail herself of it.
Morning, Mia Rabson from the Canadian Press. Just like to get back to Kashechewan for a moment. What do we know about how this was spreading in the community, the impact from the kids who weren't vaccinated to those who were, and what are we doing to try and prevent this from happening in another community, knowing that kids under 12 are not going to be vaccinated, at least for several more months?
I'll answer those questions in reverse order. The ultimate preoccupation when you see something that happening is figuring out first how to deal with it, which is what we are doing now. I mean, the epi curve is on the downtrend at a 65% reduction week over week, which is great, but they're not out of the woods, and what we need, as we know with any spread of COVID, there are a multiplicity of factors that kind of cascade to make this type of nightmarish scenario where 20% of your community, so they're 2,000, so 10 to 15% of your community has gotten infected. Again, as I mentioned, the upside to this is the very important firewall that the double dose of vaccine early on allowed people to stay safe, particularly those that are more vulnerable, elders being 7 times more susceptible to being admitted into ICU. But it is preoccupying given the long-term potential effects on children. There are a large number of communities across Canada that have a high youth proportion. And so as we look and do sort of, I guess the term of art you guys use is a hot wash of the, anyway, whatever that means. But as we analyze on the go what's gone right, what's gone wrong, the ability to apply it into different communities to make sure that that public health message keeps getting out, because the vaccine is important and we're getting it out in rates that are above the Canadian average, but it isn't the only tool. And with the unvaccinated, particularly the 12 and under, you're basically in a game of controlled risk. So whether that's more remote learning, looking at the different factors that play into going back to school, ensuring better PPE and supplies as they go into a new school year, deploying that second dose as quickly as possible, which is a little more troublesome with younger groups. They kind of take a little longer. So a number of those factors that we just keep doing what we did at the very beginning, which is re-upping the, as people naturally let down their guards, noting that youth population is still very vulnerable. And frankly, it's vulnerable in non-Indigenous communities. So this is a lesson to downtown Toronto or downtown Montreal that, there's a large population that is unvaccinated, and that comes with risks and potential spreads, particularly as what Tom mentioned with variants that could be more dangerous and are much more unpredictable. So continued work over the next little while. That's why the budget had COVID supports for Indigenous communities over the next 2 years, because we need to be prepared for the unexpected.
And maybe for Dr. Wong, I'm still curious, though, what we know about how well the vaccines did protect the people who were fully vaccinated in the community from this spread, and sort of what the level of infection and also severity of infection was as a result.
Yeah, thank you very much, for the question. The vaccine works very well, whether it's the mRNA vaccine, or, the vector-based vaccine. But just focusing our attention, whether you're talking about Pfizer or Moderna, both work extremely well. And we've seen that, not just, in the community, but across Canada. When you actually take the vaccine, yes, the level of protection is so good, that when you actually look at the unvaccinated population in the community, their risk, is 8 times that of, the vaccinated, fully vaccinated, individuals in the community. So this actually says volumes about, the importance of getting the vaccine when the vaccine is indicated and approved for use. However, the big question, of course, is what about the under 12? Currently, there are active clinical trials, ongoing, throughout the world, regarding that. And it is expected that there will be some results, coming in the coming months. And of course, at this point, when the time comes, for the companies to actually submit the data, for younger children under the age of 12, that would be tremendously helpful to help another layer to actually help protect younger children and the community. One of the things about younger children, though, right now, even though the vaccine is not indicated for under 12, however, all the other public health measures, they can be mobilized to help protect younger children. And of course, going back to what the minister said earlier, about the social determinants of health, the housing, for example, it is, one of the critical factors, that the country needs to address.
Specific to Kashechewan, or were you talking in general in terms of the 8 times less?
Those statistics is specific for Cash, but likewise, elsewhere as well. Of course, when you actually, see the vulnerability, of overcrowded housing and the intensity and frequency of exposure to the virus, this is so important to actually get both doses, in the arms as soon as possible.
Thanks, Mia. That concludes today's press conference. Ceci conclut la conférence de presse. Merci.
Opérateur de la téléconférence, pourriez-vous rester en ligne, s'il vous plaît?
Oui, certainement. Un moment.